So as Liz mentioned, I'm Director of Technical Operations, which, great, what does that mean? I lead all the internal multiplication, production, and health for the Maschhoffs. I've also had the opportunity to spend 7.5 years as a private practice veterinarian and practice owner here in Northwest Iowa. So what you'll get from me today is really my perspective on guidances 209 and 213, as well as the recently published rule on VFDs. You'll get veterinarian's perspective, both from a system level and from practice level, as well as a producer's perspective and what this is likely going to mean to us in the field, and really how are we going to take a system approach to the regulations. So how did we get here? Obviously these two gentlemen painted a much better picture for you than I'm going to in the historical aspect, but you know, there's been more than 10 years of regulatory progression, going back to guidance 152 in 2003. There's this concern over bacterial resistance, some founded, some unfounded. Perceived food and human safety concerns. There's essentially at the root of all this, right, there's an erosion of trust in protein-producing industries. The consumer doesn't trust the folks who are delivering them their product anymore. Why is that? In my opinion, there's a detachment of the consuming public from their food source. In this country, between 1930 and about 2007, the U.S. population increased 240%. Over that same time span, the number of farms, what was classified as a farm in the United States, decreased by 70%. So you got two lines going in opposite directions, and that's a problem. So guidance 209, judicious use of medically important antibiotic drugs in food-producing animals. This established the recommended principles for appropriate use of medically important drugs, that being the big key as we look at how this is going to affect us in the field of medically important drugs. Limit the necessities to assuring animal health under veterinary oversight. Big deal that prevention, control, and treatment are all three still considered judicious use. So it's not a ban. It's not about not using antibiotics. It's about judicious use of antibiotics. Guidance 213, voluntary phase out of growth promotion feed efficiency label claims of all medically important antimicrobials. Voluntary is in italics because it's not voluntary. And as far as I'm aware, everybody who had a growth promotion label in the industry level has signed off. So this one's a done deal. It'll move all current over-the-counter water meds to prescription. There's a 3-year window, as Liz mentioned, by the end of next calendar year. This is in full effect. So we've got about 18 months to figure it out. And the rule on VFDs, moving at the same timeline. The final rule was announced yesterday, Tuesday, something like that. And again, it'll move all OTC feed meds to VFDs as well. So going back to medically important, guidances came out and defined these 4 classes of antimicrobial drug rankings: critically important, highly important, important, and non-medically important or exempt. Why is that important? Because some of the antibiotics that we use land in the non-medically important bucket. Also, this is based on the risk to human medicine. This is not based on the risk to animals. It's not based on how we use them, but it's based on the risk of an adverse effect occurring from a resistance. So in the non-medically important bucket, just to give you some understanding of what's there, let you read those for yourself, but obviously some medications within the swine industry that we do use on a regular basis, judiciously, I would argue, and they are outside of the scope of this. So what are the implications? So disallowance of the use of medically important antibiotics for growth and feed efficiency. That does have a potential negative impact to feed conversion. We, in our system, would estimate that to be 1 to 1.5%. Veterinary Feed Directive is required on all medicated feed products, anything with a medical important antibiotic. All new feed meds that will be approved going forward will be approved under VFD. Move all OTC water meds to prescriptions. So that's kind of what's going to happen. What does the future hold? They will collect and have been, but they'll continue to collect and scrutinize antibiotic sales use data, and they'll benchmark that. I think there's a whole lot of discussion yet to occur. How they benchmark it, how is it measured? Will it be volumetric, to the doxycycline question? But this will be an ever-increasing discussion. Again, disease prevention, control, and treatment is considered judicious for now. I think there's a big question about how long does prevention stay there? How long does control stay there? It's, again, not likely to go away anytime soon, given that there's always increasing advocacy pressure on those. And if the process stumbles or there's a high non-compliance, what does the fix look like? Was it Ronald Reagan, 9 scariest words? I'm from the government and I'm here to help. If this doesn't roll out well, what does version 2 going to look like? So the rule that was published, the final rule here on Tuesday, streamlined the VFD process. The major changes or alterations, as near as I can understand them. It does appear we will be able to list multiple sites on a single VFD, and I've caveated that by saying details still to be determined. It's heavily stated within the confines of a veterinary client-patient relationship. That's defined in most places by the State Veterinary Practice Act. In places that don't have a State Veterinary Practice Act, it's defined in the regulation. I think there's a lot of definition yet to come around what does that actually mean, how are they going to regulate against what's written. There's a 6-month expiration on the VFDs. Refills are only allowed if label approved, and there are no label approved refills today. So that's sort of a non-issue going forward. Maybe that's an opportunity. It'll be used an approximate number of animals to be fed instead of tons of medicated feed as it is today on VFDs that are out there. And it'll be electronic format rather than today's triplicate version. Interestingly, I sort of naively thought, well, hey, the government's going to give us a form because the government loves forms, and this is what we'll use for everything. And that's not the intent. The intent is that the manufacturer will supply the VFD for the particular product. Or, interestingly enough, it says that the veterinarian can provide the VFD as long as it contains the pertinent information. So I'm not exactly sure what that means, quite frankly. It sounds a bit helter-skelter to me. So I think there's a lot of definition in the next 18 months as we learn how they plan to regulate around this. So what are the impacts to the industry? And maybe these are perception, maybe they're reality. You know, economic impact of reduced feed conversion, increased morbidity, increased mortality. Supply and demand of feedstuffs. If the animals are converting less efficiently, what does that do to gain? What does that do to space? What does it do to feedstuffs? If we have decreased market competition through regulation, what does that do for existing products in the marketplace? And will manufacturers use that as an opportunity to increase the price of those products? One of my fears is this is going to take an administrative army to facilitate. If you think about VFDs, 6-month expirations, our system has north of 500 sites. We operate in 9 states. We're going to have scripts on every water med that are over the counter now, plus any medically important feed-grade antibiotic. How is that going to look? That could take quite a few folks. And back to my days in practice, you know, medicated floor stock. You know, the family that's got a handful of hogs in the backyard for an FFA project, they're not going to be able to co-op and be able to go to the co-op and get a product that has OTC in it. How's that going to get handled? So what's that mean for the producers? You know, quite frankly, we're taking away another tool from the toolbox. We are being limited on our ability to use judgment. Some of it's necessary, some of it's not. It will absolutely change strategies and feed medications. No ifs, ands, or buts about it. This will change those strategies. There's potential loss of efficiency and revenue that's going to come from that. And again, we're facing increased regulatory conditions. You know, tracking feed orders and deliveries, managing all the VFDs and scripts. Is that going to land on the producer? Is it going to land at the, you know, the feed mill, the veterinarian? There's a lot of opportunity in there, obviously. And then just documentation and maintenance of records. So from a system level, again, thinking about, you know, specific to the system I worked with and have in the past, but flow constraints. Are we going to be, is there going to be limitations on where we place animals basis how we want to use medications in the future that we don't deal with today? Feed constraints. Are you going to need to go to just one flat feed program for every pig, regardless of health status, source, flow, finishing location, etc.? If there's a last-minute change in the PED outbreaks, we literally were rerouting trucks while they were on the road because we found out that the barn they were going to or the barn they came from just broke a PED. And so we were literally rerouting trucks to try to keep other pigs out of harm's way. This is going to limit that. It's going to affect our ability to make those decisions. Toll mill relations and management. This is one actually that our feed team is very concerned about. If you're in a toll milling situation, who's responsible for the VFD? Who owns that? Who owns the documentation, the management, the quality assurance if there's an issue? I think this will lead to a decreased willingness and ability to change those feed med protocols. And this is not a small task. This is something that's going to take a very dedicated effort, particularly on the front side, to determine how do we plan on managing these things, and getting it beyond that to a maintenance level, and what's that going to take from a staffing infrastructure to support. So from the system effects, again, the administrative support, it's going to cross a lot of different departments. And if that's an external relationship, probably makes it that much harder. Maintaining records and timelines will be critical. 6-month renewals on VFDs, turning over sites, changing flows, managing scripts to understand when a water med script may or may not be expiring, and then specific data warehousing and notification capabilities so that you have some kind of push system that tells you this script is about to expire, rather than getting a phone call saying, hey, I can't send you the product, it's Thursday afternoon, you won't be able to get it till Tuesday. That's a problem. But hey, I'm a glass half full guy. I'm an optimist. I always have been. The FDA wants this to be successful. It has to be successful. If it's not, the FDA has egg all over them, right? So they're going to do everything they can to make this a successful program. Now, we got to help them understand how to do that, right? There is no question, if you read the VFD directive that came out, VCPR is mentioned in that thing no less than 100 times. They have, the regulatory agencies, the legislative people, the consumers, the customers, they have put their faith in the veterinary profession. Now, I'm biased. I'm a veterinarian, so I could say that, right? But it's a good thing. Veterinary oversight is a good thing. We do have an opportunity to break old paradigms. We have an opportunity to leverage technology. We'll learn new things in this process that will get us better. And at the end of the day, this industry is creative, it's resilient, it's nimble. Always has been, and frankly, I think always will be. So this is another one of those things that up front, it'll take us a little bit of time to understand it. We'll have to change how we do things. But at the end of the day, I don't expect this to flex anybody off course.